For those suffering from sleep apnea and have had orthodontic treatment involving extractions, then today's topic will be of interest to you as I explore this issue. Hi, I'm Peter Miles, an orthodontist, and I aim to give you the straight talk about orthodontics. Now, sleep apnea is a serious condition resulting in excessive daytime sleepiness, which can affect concentration and potentially increase accidents. It also increases the risk of high blood pressure, stroke, and heart disease. More recently, some have suggested that extractions of adult teeth can limit tongue space and cause sleep apnea. Now, this supposedly forces the tongue back, thereby compromising the airway. Now, this sounds plausible in theory, but what is the evidence? And I'm glad you asked. It's been claimed that extractions narrow the jaws. However, if you measure between the pointy canine teeth, the measured distance actually gets wider. Now, this paradox is due to the shape of the jaw being an arch, which is wider at the back and narrower at the front toward the canine teeth. So extraction spaces are closed, the molars move forward into the narrow part of the arch, but the canine tooth move back into the wider part. But the actual arch itself hasn't changed and in fact has often widened due to the mechanics and the arch formed used by the treating orthodontist. Now, about 75 to 85% of orthodontic patients in Western countries are treated without extractions, so only a minority of cases require extractions to relieve crowding. In these cases, the front teeth stay where they were or even advance, again depending upon the treatment plan your orthodontist has prescribed. An even smaller number of patients are treated with upper and lower extractions of 4 teeth. Now, sometimes extractions are done also deliberately to reduce protrusion in someone with bucked or a very full lip profile. A research paper from 2015 in the Journal of Clinical Sleep Medicine compared patients who had 4 premolars or bicuspids removed with those having had none out and found the number of people with sleep apnea was no different. The investigators therefore concluded that orthodontic extractions are not a significant risk factor for obstructive sleep apnea. Now, orthodontists do not take the decision lightly to extract teeth, but if you're unsure, ask them why they may have recommended them in you or your child's case, but also some of the risks of not extracting. Now, as always, feel free to share this with friends and relatives, or comment and ask questions. Thanks for tuning in. I'm Peter Miles, and I'll see you next time for more straight talk about orthodontics.